This Partners in Healthcare segment is sponsored by Care Alternatives.
Care Alternatives is committed to delivering comprehensive hospice services by treating the whole person, mind, body, and spirit. Administrator Erica Falvo and Community Education Liaison Bob Urachek are here to share more about how Care Alternatives embraces this holistic and personalized approach to hospice. Good morning, you two. Thanks for coming in.
Good morning.
This is a time in many families' lives or individuals' lives that until you're there and you've experienced it, you may not know what to expect. Tell us a little bit about the Hospice 101, really.
Well, Jessica, hospice is a healthcare service that provides not only emotional but spiritual support to the patient, the family members, and the caregivers. And basically, in order to qualify for hospice, you need to be a person or a patient who is terminally ill, have a diagnosis of 6 months or less given to you by a physician. And Erica.
And basically what we do at Care Alternatives is we've been around a very long time, since 1995, so we've had a lot of practice in hospice care. Virginia is our 7th location to open, so we've been here about 3 years now and actively taking patients for about 2 years. So we're able to really figure out what the Virginia community needs and reach out and kind of educate them on hospice services.
What have you found that the Virginia community does need? What is the difference with Care Alternatives?
The difference with us is we use traditional medicine, so the nurses, the home health aide, chaplain services, and also social workers, as well as alternative therapies. Things like Reiki, massage therapy, reflexology, pet therapy through our volunteer services program, which is a very different approach to hospice care. We also use specialized programs for end-stage dementia, also for end-stage cardiac disease, and for our veterans as well, because we really want to celebrate them and make them feel special.
When families find themselves in the position that they may look to hospice services, how does it work? Do you interview different companies, such as Care Alternatives, to find if it's a right fit? Is it a personality match?
Typically, families will interview a couple different hospices and kind of see what they like about each one. With us, we do have those alternative therapies. We have the special programs. We also use aromatherapy oils, which is a really nice thing for the families to be able to use with their loved one. They're specially made for Care Alternatives. They can be made for helping with some sleep or relaxation, or even a peppermint oil for some energy as well. So sometimes those things kind of set us apart, and families will choose to go with us for the extra services. And the last thing that we offer that's really different is Dream Catchers. It's a last wish program that is for the patient and the family. It can be something as simple as a dinner in the home or a flight out to California to see a family member that they haven't seen in a long time.
And how do you find that families respond to these kind of alternative methods of care?
Well, the response has been very positive. Basically, there are 4 areas that are common to all hospice agencies, and they are the skilled nursing services, home health aides, spiritual counseling, and also
And our chaplain services.
chaplain services. Sure.
So they're very appreciative that these alternative options are available.
And typically at first they're a little bit weary. Maybe they haven't heard of Reiki or reflexology. So we try to bring out the volunteers and educate the patient and the family. Sometimes we'll have the volunteers actually double up, and maybe someone will work on the patient and someone will work on the spouse. So that way they kind of know what they're getting and they feel a little bit more comfortable. Also, any accounts that we work with, as far as hospitals, nursing homes, assisted living, we do something called a spa day, where we bring in a Reiki volunteer, a pet therapist, and we educate the staff. So that way they know what they're telling, their residents and the different members of the community, because they've had Reiki, so they can talk about it from firsthand experience.
Quickly, what is Reiki?
It's kind of like an energy work. It's very calming. It can also help to reduce pain and bring comfort to the person. And everyone is trained and certified that is a volunteer with us. They go through 16 hours of training, and we have to have their certification on file for the massage, the reflexology, the Reiki, the pet therapy.
Fantastic. Well, thank you very much for introducing us today and the work that you guys are doing. We'll let everybody know how to get in touch. If you'd like more information about Care Alternatives, one of your partners in healthcare, you can visit them at 6802 Paragon Place, Suite 103, Richmond, Virginia, 23230. Give them a call, 673-1330, or you can visit online and learn all about it anytime at carealt.com.